And now we begin our talk with our first speaker, Dr. Manisha from the National Cancer Society Malaysia. And let me give the brief introductions about Dr. Manisha. Dr. Nur Manisha obtained a diploma in Medical Science Laboratory Technology from PTPL College, Sharjah. And her degree in medicine was from Ternopil State Medical University, Ukraine. She has worked as a medical lab technologist in Tawakal Specialist Hospital, Jalan Kupang, Kuala Lumpur, and conducted medical tests for a wide number of departments, including biochemistry, serology, microbiology, and so on and so forth. She was attached at Hospital University Science Malaysia, Kelantan, under various departments such as medical, surgical, and so on and so forth as well. She has experience working at managerial Sdn Bhd, analyzing and reviewing provider claims, hospital statement of account, and all pending files regularly to clear for payments of bills and ensure outstanding bills are within reasonable aging. She is also knowledgeable in using ICD-10 coding, probably maybe your explanations, what's this? And currently, Dr. Nur Manisha is working at National Cancer Society Malaysia as Education Department Executive since 2013, mainly giving talks on cancer awareness and writing up articles and pamphlets. So let us put our hands together to welcome Dr. Manisha to give her talk.
First of all, I would like to say thank you for inviting me here, and I'm so honored to be here with every one of you. Okay, well, I'm Dr. Manisha from National Cancer Society, and today I would like to talk about general cancer awareness. Right, in my talk, it will contain about what is cancer, type and origin of cancer, the risk factors, prevention and early detection, and also diet and general well-being. Okay, first of all, I would like to ask, what is cancer? What do you have in your mind about cancer? So what cancer does mean to you? Of course, it's a terrifying illness, isn't it? Right? And some people say that it's fear. Because when you talk about cancer, when you say cancer, the word cancer, you're already frightened. Okay? But many people claim that, I won't have cancer because, it won't happen to me because I'm strong. Like the Superman. Because I'm too young. Nobody expects that young people get cancer. And then no one in my family has cancer. And maybe also they will say that, I have a healthy lifestyle. I don't smoke, I eat regularly, I have a regular exercise, I eat well, so how can I get cancer, right? But it's all just lame reason. Yeah? Because cancer can happen to anyone, and can happen to all the nationalities, age of groups. Yeah? In fact, cancer essentially has a lot of impacts. When a person is diagnosed with cancer, it is not only impact with the person itself. And actually it has impact with the family members, with the maybe friends or neighbors. That's maybe for the personal relationship with the people surrounding them. But then about financial, once they got detected with cancer, they will have in their mind that how they're going to do with their treatment, because cancer treatment is very expensive, right? So that would be like things in their mind, like all these questions, like how to mix, how to tell. They don't know how to find a financial, solve the financial problems. So end up they will just keep themselves in the house, and then they won't go out and share their thoughts or share their problems with everyone. Which is actually like many people from outside will try to help them. Alright. For short, I just want to explain a bit about what is cancer, right? Okay, cancer is a non-communicable disease and is uncontrolled growth of cells, okay, which I will explain later. What is it about? And is capable of spreading, and it results in death if not controlled. Right? So these are the some types of cancer cells. Right? Isn't it look beautiful? Okay, from here, what can you see? Like familiarize between all of these cells. Yeah, besides of their different colors, but it's actually like have one similar character from the cell cancer. What is it? Got? Yeah, head and claws. Right? It's like cancer, like crab. That's why cancer, for zodiac cancer, it seems like crab. It's a sign of crab. Yeah? Okay, to understanding about cancer, okay, let me explain to you the differentiation between normal cell and cancer cell. Okay, in normal cell, our cell will grow and it will divide and it will grow until old and one day it will die. But for cancer cell, it will grow out of control and divide and become a lump, and that's what you call it tumor. And tumor, so they have two types of tumor. Okay, non-cancerous and cancerous tumor. Right? For non-cancerous, we call it as benign, which it can be removed, but it can't grow back, and it will not invade to the blood vessels or lymph nodes. Okay, whereas malignant is a cancerous cell type, sorry, it will invade and it will damage the nearby tissue. Okay, I will show you, and you call it, this is what we call it, the spread, we call it metastasis. Okay, these are the example of the how the normal cell become an abnormal cell. Okay, if you can see our normal cell, okay, when it develop more of cells with uncontrolled dividing, so it will become a malignant and or invasive cancer. And at the late stage, it will go through the vessels and lymph nodes. Yeah? And this is what we call it metastasis. And it will spread to other organs such as kidney, brain, and bones. Okay, the high risk factor and statistic, a bit of statistics. Okay, high risk factor, of course, the biological is like over 55 years old, and immune system malfunction, okay, and hormonal issues. Whereas environment, as we know, radiation, sun exposure, and maybe second-hand smoker. Okay, behavior with high fat and low fiber intake, overweight, okay, sedentary lifestyle, and tobacco intake, and release hereditary, which is family history. Okay, statistics in cancer in Malaysia, there are about 1 in 4 Malaysians are at risk in developing cancer. Okay, and it more happens to females than males. And every 12 minutes, a person is diagnosed with cancer. And cancer doesn't discriminate with age, gender, or race. Okay, just quick statistic. Okay, for breast cancer, it's about 1 in 90 Malaysians may develop. And 1 in 33 Malaysians may develop for colorectal cancer. And in 1 in 40 Malaysians may develop lung cancer. Okay, the 5 most common cancer in women are, okay, as everybody knows, breast cancer is the first, then cervical cancer, colorectal cancer, lung, and ovary. Whereas for men, the 5 most common cancer in men is lung, colorectal, nasopharynx, prostate, and stomach. Okay, for the prevention and early detection, okay, these are the top 5 cancers. Okay, for instance, for breast cancer, we can do the early detection by doing mammogram, ultrasound, breast self-examination. Okay, for ultrasound, we usually do for age below 35. Okay, for mammogram, they do for age above 35 or above 40. Yeah. And cervical cancer, to do the prevention, we have to do the pap smear and also the vaccination. Yeah. Okay, these are the 10 warning signs of cancer. Okay, maybe not everybody knows about this. Okay, I will just rule one time. Okay, first, maybe there's a change in bowel or bladder habits constantly for duration of 2 to 3 months. Okay, and second, maybe it's like unusual bleeding, yeah, from any opening of the body. And third is an unexplained lump or swelling, yeah, and maybe a persistent pain and discomfort of abdomen. And number fifth is an obvious change size or textures in the skin, spot or wart or mole. Right? That one can cause from HPV. Because HPV is not only can cause cervical cancer, but it actually can cause also for nasopharynx. Yeah? Because HPV is variety. They have a lot of types of HPV. Okay? And number 6, a sore that does not heal, changes color, ulcerate or bleeds. Okay, 7, unusual bleeding from nose, hearing or ringing sound in the ears. Okay? And 8, indigestion or difficulty in swallowing. This might be cause of esophageal cancer. And 9 is hoarseness of voice or nagging cough more than 2 weeks. Yeah? Especially for like lung cancer and especially for non-smokers. Right? And the last is unexplained tiredness or weight loss of 10% or more within the period of 3 to 6 months. Okay. For girls who like to lose weight, okay, suddenly they have lost weight for maybe like 10 kilos within this month. Don't think that you are healthy or what. You should seek for, maybe there's some problems because you lost weight within a short period and it's a lot. Yeah. Okay. For the diet and general well-being, cancer can be prevented with these 3: okay, weight, diet, and physical activity. Okay, weight, it can contribute to 14 to 20% of all cancer deaths and increase risk of breast, colorectal, esophagus, kidney, and pancreas. Okay, these are the BMI. Right? I think everybody knows how to count BMI. Is it? No one? Okay, this is the international index for BMI, but we use this for Asian because Asian have a small, small type of body, not like the international people. They have a big size of body, right? Okay, and healthy diet. Okay, healthy diet means what? It means that it's a major source of energy and can disease prevention and weight control and can improve quality of life. And about 6 glasses of beers can increase your risk of having cancer 9 times. Yeah? And while smoking can increase the risk of having cancer 50 times. So those who are smoking, please beware. Okay? And of course, less fat and red meat as part of the lifestyle. We have to take less meat and more fibers actually. Okay? And yeah, sedentary lifestyle, lack of activity, physical activity. Okay, for cancer risk factors, okay, in this pie chart, as you can see, okay, for tobacco, smoking, and diet and obesity is actually the main cause of someone getting cancer. It's not because of your hereditary, your family history, because family history just takes about 15% to 20%. But many people say that when someone got cancer, they say, oh, it is because of mother or the family members who had cancer, and that's why it comes to the person. But it's actually from your lifestyle. So if you take care of your lifestyle well, then you can prevent from cancer actually. Okay, so you just look at the pie chart. It's more than 50%. Okay, about 62% is caused from lifestyle. Okay, for conclusion, in general well-being, just staying healthy. You need like do your meditation, you keep thinking positive and be honest to yourself. Okay, and isolation and company, you must have a good company to build up your strength in, to do a good lifestyle and stay a healthy weight. That one you have to remember. Okay, be active, eat healthy diet, and quit smoking. Okay, I think that's all from my side. Okay, so say no to cancer.